Hello and welcome to our webinar on hepatitis B and C screening. My name is Jennifer Boniface and I am one of the nurse analysts with the Provider Outreach and Education team. Today's webinar will focus on the clinical aspects for the Medicare preventive services of hepatitis B and C screenings. I have a few housekeeping items to go over with you before we start the webinar. You can find the link to the encore presentation of this webinar on our website's Training Center page at www.wpsgha.com. It will be accessible for the next 60 to 90 days. Additionally, the recording will be uploaded to our YouTube channel under the Encore Presentations playlist, and both should be available within the next 15 business days. If you have any questions, please put those questions into the chat. We will answer questions as time permits. And should we be unable to answer a question during the webinar, we will create a follow-up document and send it to all attendees afterward. We really want your feedback. It helps us develop the education on topics that may be of interest to you. Consider taking our survey to let CMS know what you did like and what topics you'd like to learn more about. And Mary Sue will place a link to the survey into the chat. There will also be an opportunity at the end to take the survey. Additionally, you can provide feedback by completing the survey while viewing the encore presentation. To access the survey, click on the circle with the eye in the upper right corner of the video. A link to the survey can also be found in the description of the video. On this slide, we have our disclaimer. As we all know, Medicare rules change often, so please make sure you're looking at official CMS communications for the most up-to-date rules and regulations. These do take precedence over anything that is presented today. And as a reminder, CMS prohibits recording of this presentation for profit-making purposes. This presentation is being recorded by us and will be posted on the Training Center page of our website under Encore Presentations, as well as on our YouTube channel under the playlist Encore Presentations. On this slide, you'll notice several acronyms that will be used throughout the presentation. While you might already be familiar with many of them, feel free to refer to the slide if you come across an acronym you don't recognize. World Hepatitis Day is observed on today, July 28th, and that is observed every year on July 28th. In 2022, it was estimated about 254 million people were living with chronic hepatitis B, while almost 50 million had chronic hepatitis C. Hepatitis B and C can result in long-term health issues, including liver damage, liver failure, liver cancer, and cirrhosis. Medicare provides coverage for screenings of both hepatitis B virus and hepatitis C virus infections as part of the preventive services benefits under Medicare Part B. Our objective for today is to provide an overview of the clinical aspects for the Medicare preventive services for hepatitis B virus screening and hepatitis C virus screening. We will cover background information on hepatitis, treatment options and preventive strategies, and Medicare Part B coverage criteria for screening for hepatitis B virus infection and screening for hepatitis C virus infection. Let's begin with some key facts and statistics regarding hepatitis B and C viruses. The CDC estimates that approximately 850,000 to 2.2 million people in the United States are living with chronic hepatitis B. Around half of those with hepatitis B are unaware they are infected. Research suggests that between 2.7 million and 3.9 million people in the United States are currently living with chronic hepatitis C. Approximately 75% of the individuals with HCV are baby boomers, who are people born between 1945 and 1965. According to the National Institute of Drug Abuse, it is predicted that 1 million people with untreated chronic HCV will likely die from related complications over the next 40 to 50 years. The U.S. Department of Health and Human Services Office of Minority Health reports that non-Hispanic Black individuals face a 1.4 times higher risk of dying from viral hepatitis compared to their non-Hispanic white counterparts. Additionally, the prevalence of chronic hepatitis B among non-Hispanic Black individuals is more than 4 times higher than that of non-Hispanic white individuals. They are also over twice as likely to die from hepatitis B and nearly twice as likely to die from hepatitis C. According to the CDC in 2022, the incidence of newly diagnosed chronic hepatitis B cases among non-Hispanic, Asian, and Pacific Islander individuals was 11 times higher than among non-Hispanic white individuals. The CDC also reported that in 2022, the rate of acute hepatitis C among non-Hispanic, American Indian, and Alaska Native individuals was 1.9 times greater than that of non-Hispanic white individuals. Hepatitis refers to liver inflammation resulting in viral infections, excessive alcohol consumption, exposure to toxins, specific medications, and certain medical conditions. Viral hepatitis is caused by 5 different types of the hepatitis virus. The first type is hepatitis A. Hepatitis A is transmitted through feces and blood of individuals who are infected. It is spread through the consumption of tainted food or beverages or through close interaction with an infected individual. The next type is hepatitis B. There are 2 types of hepatitis B, acute and chronic. It is transmitted through the blood or other bodily fluids from individuals who are infected. The third type of viral hepatitis is hepatitis C. Hepatitis C is one of the most common types of viral hepatitis in the United States. There are 2 types of hepatitis C, acute and chronic. It is typically transmitted through contact with blood from individuals who are infected. Hepatitis D is the 4th type of viral hepatitis. Hepatitis D is transmitted through the blood or other bodily fluids containing blood from individuals who are infected. This type of hepatitis only occurs in individuals who have already contracted hepatitis B. It also presents as either acute or chronic. And finally, hepatitis E is the last type of viral hepatitis. Hepatitis E is transmitted through the feces of infected individuals, typically through the consumption of contaminated water. It may also be transmitted through the ingestion of undercooked or raw meat from infected animals. This type of hepatitis rarely occurs in the United States and other developed nations. It typically resolves on its own, and the majority of individuals fully recover without experiencing any lasting complications. Hepatitis A, hepatitis B, and hepatitis C represent most of the viral hepatitis cases occurring in the United States. Today, we're going to focus on 2 types of viral hepatitis, of which Medicare provides preventive services, hepatitis B and hepatitis C, and we'll start with hepatitis B. Hepatitis B is a viral infection of the liver caused by the hepatitis B virus, or HBV for short. There are 2 types of hepatitis B infections, acute and chronic. Acute hepatitis B infection is a short-term infection, usually lasting no longer than 6 months. Most adults with hepatitis B fully recover, even if the symptoms are severe. In some cases, treatment may not be necessary, as the body's immune system will eliminate the virus and the person will recover from the acute infection. This is often the case with individuals who contract the infection during adulthood. However, anyone infected with hepatitis B has the potential for the acute infection to become chronic. The risk of this occurring is higher in individuals who contract the virus at a younger age. Chronic hepatitis B is a persistent viral infection of the liver that lasts longer than 6 months. It occurs when the person's immune system is unable to successfully fight and clear the HBV from the body. Chronic HBV infection has the potential to persist throughout a person's lifetime and may result in several hepatic-related complications. So who is most at risk for hepatitis B? As previously mentioned, the hepatitis B virus is a bloodborne pathogen that spreads through blood or other bodily fluids from an infected person. People who are at risk of exposure to bloodborne pathogens are most likely to contract hepatitis B. And this includes people who have sex with someone who has hepatitis B, especially without using barrier protection, individuals engaging in sexual activity with multiple partners without using barrier protection, those who currently have or previously had sexually transmitted infections, men who have sex with other men, IV drug users, including those who share needles, syringes, and other type of drug equipment, infants born to a mother who has hepatitis B, people living with a person who has chronic hepatitis B, Individuals working in a profession that can increase their likelihood of being exposed to blood or bodily fluids, such as healthcare workers and emergency responders. Those who are currently incarcerated or have been incarcerated in the past, as well as those who work for the prison system. Those who live or work in a facility that provides care for individuals with developmental disabilities, people with certain medical conditions such as diabetes, hepatitis C, and HIV, individuals on dialysis, people who received blood transfusions or an organ transplant prior to the mid-1980s, and individuals who have lived or traveled to areas of the world where hepatitis B is more prevalent, such as Asia, the Pacific Islands, Africa, and Eastern Europe. Not everyone with hepatitis B exhibits symptoms of the infection. Some individuals may remain asymptomatic until complications occur. That is why early screening and treatment are essential for anyone at risk, even if they show no symptoms. Symptoms of acute hepatitis B usually appear within 90 days of exposure, although they can develop anywhere from 2 to 5 months after exposure. Symptoms may include abdominal pain, joint pain, jaundice, dark yellow urine, gray or clay-colored stool, fever, nausea and vomiting, weakness and fatigue, and loss of appetite. An acute hepatitis B infection can progress into a chronic form of the disease. Individuals with chronic hepatitis B are at a higher risk for severe complications, including cirrhosis of the liver or scarring the liver leading to impaired liver function, hepatocellular carcinoma or liver cancer, liver failure, development of kidney disease, inflammation of the blood vessels, and death. Another potential complication is reactivation of the hepatitis B virus. Immunocompromised people with chronic hepatitis B infections are at a higher risk for this. Examples include individuals taking immunosuppressive medications such as chemotherapy, those on anti-rejection medications for organ transplant, those taking medications for hepatitis C, and people with HIV. Diagnosis of hepatitis B virus begins with a comprehensive history and physical examination. This includes collecting information from the patient about any symptoms that may suggest a potential HBV infection, any personal or family history of liver problems, including previous HBV infections, liver damage, or liver cancer, any risk factors the patient may have that may increase their chances of HBV infection, and any lifestyle factors that could contribute to liver damage, such as use of hepatotoxic medications or alcohol consumption. After thoroughly reviewing the patient's personal and family medical history, symptoms, risk factors, and lifestyle factors, a physical examination is conducted. During the physical exam, the healthcare provider should check for any signs of liver damage, including but not limited to symptoms of acute hepatitis B infection previously mentioned, as well as jaundice of the skin and whites of the eyes, abdominal tenderness, itchy skin, and edema or swelling of the lower extremities. Next, blood testing can be performed to determine whether hepatitis B virus is present in the patient's body. The Centers for Disease Control and Prevention recommend the triple panel test be performed when screening for hepatitis B virus. The triple panel test includes testing for hepatitis B surface antigen, hepatitis B surface antibody, and total antibody to hepatitis B core antigen. If it's determined the patient has the presence of HBV, further testing can be completed to determine whether the patient has an active versus chronic HBV infection and how much liver involvement or damage is present. An acute HBV infection is diagnosed by the presence of positive hepatitis B surface antigen, positive total antibody HBC, positive immunoglobulin M total anti-HBC, which indicates a recent infection, and a negative hepatitis B surface antibody. Chronic hepatitis B infection is diagnosed by the presence of a positive hepatitis B surface antigen, positive total antibody HBC, negative immunoglobulin M total antibody HBC, suggesting the infection is not recent, and a negative hepatitis B surface antibody. A resolved HBV infection is diagnosed by the absence of hepatitis B surface antigen, the presence of positive total antibody HBC indicating previous exposure, and negative hepatitis B surface antibody. It's important to note that in some cases, low levels of hepatitis B surface antibody may be detected, but a negative result is typically used to confirm a resolved infection. The extent of liver damage can be assessed through imaging tests such as transient elastography, liver biopsy, and blood tests such as liver function tests. Should a person be exposed to hepatitis B virus, there are certain measures that can be taken to help prevent the infection. The person should immediately wash any wounds and skin areas that came in contact with blood or bodily fluids using soap and water. Mucous membranes that were exposed to blood and bodily fluids should be rinsed with water. It's important that the exposed person seek medical treatment as soon as possible, ideally within 24 hours of the potential exposure, so the appropriate measures can be implemented. In occupational settings, such as healthcare, the post-exposure treatment may include testing of the exposed person for anti-HBV antibodies and testing of the source patient for hepatitis B surface antigen, depending on the exposed person's hepatitis B vaccination status. If necessary, an intramuscular injection of hepatitis B immunoglobulin may be given based on test results. HBIG is derived from human blood and contains antibodies that can help fight the hepatitis B virus. It's also recommended that the individual receive the hepatitis B vaccination series at the same time as post-exposure treatment. The hepatitis B vaccination series should be administered according to the recommended schedule. In non-occupational settings, the post-exposure treatment may involve intramuscular injection of hepatitis B immunoglobulin and/or the hepatitis B vaccine, depending on the exposed person's vaccination status. Individuals who have not completed the full hepatitis B vaccination series should also finish the series according to recommended vaccination schedule. The Centers for Disease Control and Prevention have a list of recommendations for individuals who have been exposed to the hepatitis B virus. And you can find those recommendations on the CDC's Prevention of Hepatitis B virus infection in the United States under the section Post-Exposure Prophylaxis. And that link has been placed on the slide for your reference. Treatment varies depending on whether the HBV infection is acute or chronic. For acute hepatitis B, treatment may include ensuring adequate rest, maintaining a well-balanced diet, staying properly hydrated, and close monitoring of the patient's progress as they fight the infection. In severe acute infections, antiviral medications and/or hospitalization may be necessary to prevent complications. The goal of treatment for chronic hepatitis B is to slow or prevent the progression of liver disease and to prevent transmission of the infection to others. People with chronic hepatitis B will require lifetime and lifelong treatment for the disease. Treatment options may include antiviral medications, such as the ones listed on this slide, interferon injections, and liver transplant in several cases. So now let's move on to hepatitis C. Hepatitis C is a viral infection of the liver caused by the hepatitis C virus, also known as HCV. Hepatitis C is primarily transmitted through contact with infected blood. There are 7 genotypes and 67 subtypes of the hepatitis C virus. In the United States, genotype 1, particularly subtypes 1A and 1B, is the most common, accounting for approximately 75% of hepatitis cases. Hepatitis C infections are classified as either acute or chronic. Acute hepatitis C infection is short-term, usually lasting up to 6 months. However, not all acute cases develop into chronic hepatitis C. For some individuals, the immune system successfully fights off the virus, leading to its elimination from the body. However, this is not common, and in most cases, the acute infection progresses into a chronic HCV infection. Chronic hepatitis C occurs when the person's immune system is unable to effectively fight and clear the hepatitis C virus from the body. If not treated, chronic hepatitis C has the potential to develop into a lifelong infection. Those with chronic HCV are more at risk for a variety of hepatic-related complications, as well as are at an increased risk for mortality. There are several factors that can increase a person's risk for HCV infection. In the United States, the most common method for transmission of HCV is through past or current IV drug use, which involves sharing of needles, syringes, and other types of drug equipment. According to the CDC, over half the cases with available risk information were linked to the use of injection drugs. Other groups that are at increased risk for HCV infection include people who have sex with someone who has hepatitis C, especially without using barrier protection, people engaged in sexual activity with multiple partners without using barrier protection, those who currently have or previously had sexually transmitted infections, men who have sex with other men, infants born to a mother who has hepatitis C, people who have received tattoos or body piercings in a place where sterilization and sanitation procedures are not followed, people or individuals living with a person who has chronic hepatitis C, individuals working in a profession that can increase their likelihood of being exposed to blood or bodily fluids, such as healthcare workers and emergency responders, those who are currently incarcerated or have been incarcerated in the past, as well as those who work for the prison system, people diagnosed with HIV, individuals on or have had dialysis, and individuals with hemophilia who were administered clotting factors prior to 1987. Prior to 1992, hepatitis C was also transmitted through blood transfusions and organ transplants. However, current advancements in screening and testing, routine testing, have made this mode of transmission rare. Individuals with HCV infection often exhibit no symptoms and can go undiagnosed for years. As a result, diagnosis and treatment may be delayed. Therefore, timely screening and treatment are essential for at-risk individuals, even in the absence of symptoms. If symptoms of acute HCV infection are present, they typically develop within 1 to 3 months following exposures. Symptoms include abdominal pain, especially in the right upper quadrant, joint pain, jaundice of the skin and eyes, dark yellow urine, pale or clay-colored stool, fever, nausea and vomiting, fatigue, and loss of appetite. Signs and symptoms of chronic hepatitis C usually occur once the liver has sustained significant damage. These signs and symptoms include ones that were listed for acute HCV infection, as well as itchy skin, edema or swelling of the lower extremities, buildup of fluid in the abdominal region, also known as ascites, susceptibility to bleeding or bruising, weight loss, and angiomas. Some individuals with chronic HCV infection may also have symptoms of hepatic encephalopathy, such as reduced alertness, drowsiness, and confusion. The complications of chronic hepatitis C infection are similar to those of chronic hepatitis B infection. It may include cirrhosis of the liver or scarring of the liver, leading to impaired liver function, hepatocellular carcinoma or liver cancer, liver failure, and death. Just as in the diagnosis of hepatitis B infection, the diagnosis of hepatitis C infection begins with a detailed history and physical exam, which includes collecting information on any symptoms that may indicate a possible HCV infection, any relevant personal or family history of liver issues, and any risk factors or lifestyle factors the patient may have that can increase the likelihood of HCV infection. Next, a physical exam is conducted to assess for any signs or symptoms of liver damage. Following a thorough physical exam, laboratory testing of the blood can be performed to confirm the presence of hepatitis C virus in the patient. The first test is the HCV antibody screening test. This test helps determine the presence of antibodies against the hepatitis C virus in the body. A non-reactive or negative test result indicates the person is not currently infected with the hepatitis C virus. A reactive or positive test result indicates the person has been infected with the hepatitis C virus at one time. However, it does not mean the person currently has HCV infection. Following an infection, the person will continue to have HCV antibodies regardless of whether they currently have the virus, have cleared the virus, or have been cured of the virus. To determine if someone has an active infection, the healthcare provider would need to perform an HCV RNA test to detect the presence of the virus itself. Anyone with a reactive test should complete follow-up testing to determine their current infection status. If the antibody test is reactive, the next step is to perform a nucleic acid test for HCV RNA, also known as a PCR test. This test measures the amount of HCV in the body, referred to as the viral load. It confirms whether the person currently has an active hepatitis C infection. A detectable result indicates the presence of a measurable amount of hepatitis C virus in the blood. An undetectable result means the hepatitis C virus is either absent or present at extremely low levels that cannot be measured. Results from this test can assist healthcare providers in developing an appropriate treatment plan for the affected individual, as well as determine whether the treatment currently being used is effective. The last blood test we will discuss today is the genotype test. This test can assist with determining which strain of hepatitis C virus the person is infected with. Results of this test can assist the healthcare provider with determining the best treatment for the patient based on the genotype of the hepatitis C virus present. To determine the extent of liver damage as a result of hepatitis C infection, the healthcare provider may perform testing such as magnetic resonance elastography, transient elastography, liver biopsy, and blood tests such as liver function tests. The CDC currently does not recommend post-exposure prophylaxis for healthcare workers who are exposed to the hepatitis C virus. However, the CDC does outline some recommendations for testing following exposure to HCV. We will not cover the specifics of the testing process for healthcare workers during today's webinar. However, for more information on the CDC's recommendations for testing healthcare workers, please refer to the link Testing and Clinical Management of Healthcare Workers Potentially Exposed to Hepatitis C Virus under the Test the HCP. That link has been placed on this slide for your review. There are two treatment options for individuals with HCV infection. The first option involves use of antiviral medications over a period of 8 to 12 weeks. These medications help the person's immune system eliminate the hepatitis C virus from the body and may essentially cure chronic hepatitis C. According to the CDC, treatment cures over 95% of hepatitis C patients, typically with minimal to no side effects. The main objective of antiviral treatment is to ensure the absence of the hepatitis C virus in the body for a minimum of 12 weeks following the conclusion of the treatment. Some examples of FDA-approved medications for HCV are listed on this slide. The decision on whether antiviral medication is used is dependent on the hepatitis C genotype, extent of liver damage, pre-existing conditions in the patient, and prior treatments given. The other option is receiving a liver transplant. A liver transplant typically does not result in a complete cure for hepatitis C. The person will still need to continue to take antiviral medications after the transplant to prevent the recurrence of hepatitis C and liver damage. However, the person may still have the potential for being cured following the use of antiviral medications. Many of the same preventive strategies can be implemented to assist with preventing both hepatitis B and C, as well as assisting those already diagnosed in managing the diseases and minimizing the risk of complications. Strategies include practicing monogamy, practice safe sex techniques such as using condoms to reduce risk of transmission, encourage patients to get screened so they are aware of their hepatitis B and C status, and can seek early treatment if needed. Avoid the use of illegal substances, and if unable to quit, don't share needles. Be cautious when getting any tattoos or piercings. Ensure only sterile equipment is used. Avoid alcohol. Eat a healthy, well-balanced diet. If the beneficiary lives with someone who has hepatitis B or C, instruct them to avoid sharing personal items that may be contaminated with blood or bodily fluids containing blood such as toothbrushes, razors, or glucose monitors, as well as avoid contact with any open wounds or sores of a person with hepatitis B or C. And get vaccinated against hepatitis A and B. We will be holding a webinar on August 4th, 2025 at 9 a.m. Central Time, 10 a.m. Eastern Time to discuss the Medicare-covered preventive service benefit of hepatitis B vaccination. You can register for this webinar by visiting our live events webpage. Okay, so now that we've reviewed the two types of hepatitis B, or hepatitis rather, Medicare provides preventive services for, we're going to move on to chronic or to coverage criteria. The U.S. Preventive Services Task Force recommends a grade of B for both hepatitis B virus screening in adolescents and adults at increased risk of infection, and for hepatitis C screening in all adults aged 18 to 79. Grade B indicates a high certainty that the net benefit is moderate or moderate certainty that the net benefit is moderate to substantial and encourages healthcare providers to offer or provide these services. Medicare provides coverage for screening for hepatitis B virus infection for beneficiaries with Medicare Part B who meet one of the following criteria: high-risk non-pregnant adolescents and adults who are asymptomatic or pregnant women. Per NCD 210.16, screening for hepatitis B virus infection, people at high risk for HBV infection include those born in countries or regions where HBV infection is prevalent, U.S.-born individuals who are not vaccinated as infants and whose parents come from regions with very high HBV prevalence, HIV-positive individuals, men who have sex with men, people who use injection drugs, and household contacts or sexual partners of individuals with HBV infection. This NCD also states that per CMS, annual screenings should only be repeated for beneficiaries with a continued high risk, such as men who have sex with men, injection drug users, and household contacts or sexual partners of individuals with HBV infection who have not been vaccinated against hepatitis B. Medicare covers one asymptomatic screening for non-pregnant adolescents and adults who are defined as high risk. Medicare will also cover the screening annually for individuals who continue to be at high risk and don't get HBV. Pregnant women are eligible for one screening during their first prenatal visit. Women with new or continued risk factors are also eligible for rescreening at delivery. Pregnant women are eligible to have the screening during their first prenatal visit for future pregnancies, regardless of whether the woman has previously received the HBV vaccine or obtained a negative result for hepatitis B surface antigen screening. Medicare provides coverage for screening for hepatitis C infection for those beneficiaries with Medicare Part B who meet one of the following criteria: at a high risk for HCV infection, born between 1945 and 1965, or received a blood transfusion before 1992. Per NCD 210.13, screening for hepatitis C virus in adults, high risk for HCV infection is defined as those with a current or past history of illicit drug use and those who have a history of receiving a blood transfusion prior to 1992. Medicare covers screening for hepatitis C virus infection once for Medicare beneficiaries born between 1945 and 1965 who are not considered high risk, and annually for high-risk Medicare beneficiaries who continued illicit drug use since the last negative HCV screening test. Medicare will also cover an initial HCV screening, regardless of birth year, for high-risk Medicare beneficiaries. For both hepatitis B and C screenings, there is no copayment, coinsurance, or deductible as long as the healthcare provider accepts assignment. Documentation requirements for hepatitis B and C screenings include date service was provided, signed and dated physician or qualified non-physician practitioner order for the screening, test results, and documentation of any follow-up care or counseling that was given following evaluation of results, and documentation to support the medical necessity of the screening. Confirm all documentation is dated and signed with the provider's credentials. Prior to completion of screening for hepatitis B virus infection and screening for hepatitis C virus infection, ensure the patient has met the eligibility and frequency criteria for these preventive services. Hepatitis B and C can lead to long-term health issues, including liver damage, liver failure, liver cancer, and cirrhosis. Screenings for hepatitis B and C enables early detection and treatment, helping to prevent potential complications. Medicare Part B covers hepatitis B and C screenings as part of its preventive services benefit. So as a review, during today's webinar, we provided background information on hepatitis, discussed treatment options and preventive strategies, and reviewed Medicare Part B coverage criteria for screening for hepatitis B virus infection and screening for hepatitis C virus infection. I've included several resources on this slide, including links to the Medicare Preventive Services charts for hepatitis B and hepatitis C screenings, the encore presentation on billing aspects of hepatitis B and hepatitis C screenings, and our YouTube playlist of encore presentations. Please refer to this slide and use it as a reference when reviewing the presentation. We are now at the end of the formal presentation. Please remember, if you have any questions, please put those questions into the chat. If we don't get your questions today during the presentation, we will send out a document to all participants with the answers following this webinar. And I'm just going to take a look at the chat. And I do not see any questions in the chat. So if you do have a question, feel free to put it in the chat, but I'm going to move on to our closing slides. For those attending today's live event, in a few minutes, you will receive an email to thank you for attending. The email will look like what you see on this left-hand side of your screen. Do not delete it without reading it. This email contains your certificate of achievement, as well as a link to take the survey. If you have not completed it already, please take a few moments to complete the customer satisfaction survey. The contact hours for this event can be found in this email should you require them for earning credit to continuing education units. If you don't see it, please check your junk or spam folder. Make sure to add the WebEx email messenger@webex.com to your safe sender, safe receiver list to avoid these emails going to junk or spam. If you called into this webinar, just email us at wps.gha.education@wpsic.com with the name of this webinar and the phone number you used to log in, and we can email you your certificate of achievement. Following today's live event, if you think of any additional questions, you have 7 days from today to submit them. Send them to our education mailbox at wps.gha.education@wpsic.com and put hepatitis B and C screenings in the subject line. However, if you have claim-specific questions, please do not send those to the Provider Outreach and Education. Please direct those questions to our customer service department, as we do not have access to your claim information and therefore unable to look up claims. Also remember that we cannot accept any type of PHI or PII via email. If you haven't done so already, please take a few minutes now to complete a survey. Share with CMS and us about your experience today. Tell us what you liked, what we could do to improve, and suggestions for future education. Your feedback is really invaluable in helping us deliver the education that you need. We use your feedback to develop topics for future education events. There are several different options you can use to take the survey, depending on your preference. For those attending today's live event, the first option is to click the survey link in the chat. The other option is to take the survey on the CMS Qualtrics page. When you exit the webinar, you'll be asked to go to an external site. And that external site is the CMS Qualtrics page for the survey. And the message looks like what you see here with that little yellow triangle. This site is not spam, it's actually directing straight to our survey. We will also add a survey link to the encore presentation. Just click on the survey picture at the end of the encore presentation video to take our customer satisfaction survey. Based on your feedback, we've added several enhanced features to improve your educational experience. Our encore presentation videos now include chapters, making it easier for you to find key information quickly. We've also introduced training indicators during webinar registration to help you identify the intended audience for each session. We hope these enhancements make your learning experience even more valuable and accessible. Starting August 4th, 2025, the Provider Contact Center will handle only one MPI-PTAN combination per call to improve efficiency and reduce wait times. If you need assistance with multiple combinations, please call separately for each. For more information, please refer to the WPS News and Update articles, Process Change for Customer Service Change. A link to this article will be placed in the chat. On behalf of myself, Mary Sue, and Provider Outreach and Education, Thank you for attending today's webinar on the clinical aspects of the preventive services of hepatitis B and C. Remember, this presentation will be posted as an encore presentation on our training page on the WPS GHA website. For additional details on billing for hepatitis services, please check out our encore presentation titled Preventive Services for Hepatitis. This webinar is available on our YouTube channel under Encore Presentations. Don't forget to register for our upcoming webinar on the clinical aspects for preventive services for hepatitis B and pneumococcal vaccines. This session will cover the preventive service benefits and administration of hepatitis B and pneumococcal vaccines. The webinar will take place on August 4th, 2025. Remember to take our survey with the link provided. We look forward to your survey comments and hope to have you join us at future events. You may now disconnect.